Good afternoon, Professor Apesteguia. Today, my group number three, conformed by Bruno Caceres, Katherine Cachique, Angela Falcon, Jumy Huanca, Brenda Huancahuiri, Nicole Mauriz, and I, Ruben Anco, are going to present our seminary about the urinary system. First, what is the urinary system or urinary tract? It's the filtration system of the human body. It's responsible for removing toxins and waste from the body, mainly in the form of urine. In order to do this, the body must pass this waste through a series of organs, ducts, and tubes. If there are problems at any step in the process, it can affect the ability to urinate normally. Next PPT, please. Now, what is the main function of the urinary system? The urinary system filters your blood to get rid of your body doesn't need. Removes excess water and salt, toxins, and other waste products. Different parts of the urinary system perform tasks, including filter blood, separate the toxins you don't need from the nutrients you do need, and store and remove urine from the body. Next.
Uh, what are the organs of the urinary systems? Are the kidneys. The kidneys are two bean-shaped organs located at the back abdomen. One side of the spine. They have the main function of filtering the blood to eliminate waste products and excess water and solids forming urine. Two, urinary bladder. The urinary bladder is a muscular organ that stores urine until the eliminated from the body. It can expand to pass plasmodate different amounts of urine. And finally, urethra. The urethra is a tube that carries urine from the bladder to the good side of the body. In men, the urethra plays a role in the reproductive system by transporting semen from the prostate and seminal vesicles outward. Next.
The next topic is control of the urinary system. The formation of urine must be closely regulated to maintain body. With homeostasis, several endocrine hormones help to control this function of the urinary system, including antidiuretic hormone, parathyroid hormone, and aldosterone. The first, antidiuretic hormone, ADH, also called vasopressin, is secreted the posterior pituitary gland. One of these, its main roles is conserving the blood water. It is released when the body is dehydrated, and it causes the kidneys to excrete less water in the urine. Next, parathyroid hormone is secreted by the parathyroid glands. It works to regulate the balance of mineral ions in the body via. Effects on several organs, including the kidneys. Parathyroid hormone stimulate the kidneys to excrete less calcium and most phosphorus in the urine. And finally, the aldosterone. The aldosterone is secreted by the cortex of the adrenal glands, which rests atop the kidneys. Through its effects on the kidneys, it It plays a central role in regulated blood pressure. It causes that kidneys to excrete less sodium and water in the urine. Next.
How does the urinary system filter blood? The kidneys are essential for filtration. Number one, blood enters each kidney through the small arteries. Number two, the kidneys filter the blood, separating toxins from nutrients. Number three, vitamins, minerals, nutrients, and proteins return to the bloodstream. Number four, waste products and urine move of the kidneys through the urines and bladder. Number five, the bladder stores the urine. In number six, urine is expelled through the urethra. Next.
Okay, the next topic is about what conditions and diseases affect the urinary system. Many conditions can affect your ureters, kidneys, bladder, and urethra. Infection diseases or problems can appear at birth or develop as you get older. Cancer can also affect certain parts of your urinary tract. Some common urinary disorders are infections. Urinary tract infection and sexually transmitted infections can cause issues with your kidneys, urethra, or bladder. These infections occur when a bacteria enter in your urinary tract through your urethra. Your healthcare provider can prescribe medication to treat that infection. Another is kidney stones. Kidney stones are small messes that form when waste products clump together. Kidney stones or urethral stones can cause several pain and block your flow pee. Urination problems, loss of bladder control or urinary incontinence cause pee to leak when you don't want it to. It can be worse when you cough, when you laugh, sneeze, or jump. Many of these conditions consist of lower urinary tract symptoms like an urge to pee, a weak urinary stream and leaking pee. Medication and lifestyle modifications can help treat these conditions. Urinary tract obstructions, growths or tumors in any part of your urinary tract can affect the flow of your pee, and enlarged prostate can block your urethra, so it's harder to pee. Other causes of urethral obstruction include pregnancy, gastrointestinal issues. Surgery can often help with obstruction in your urinary tract. Kidney disease. Kidney disease is a common and serious condition that affects your urinary system. The most common causes of chronic kidney disease are high blood pressure and diabetes. Managing blood pressure and blood sugar is crucial to lower your risk of kidney disease. Kidney disease can lead to kidney failure. Kidney failure may require dialysis or kidney transplant. Talk to your healthcare provider about this risk for kidney disease. Another, interstitial cystitis, also called painful bladder syndrome. These conditions cause inflammation in your bladder. Medications and physical therapy can improve the symptoms of painful bladder syndrome. And finally, structural problems. Sometimes babies are born with conditions that affect the way their urinary tract forms. For example, ectopic ureter that look in the image is when your child's ureter connects to a place other than their bladder. Other urinary system organs can be underdeveloped, which can lead to issues with pain. Bladder prolapse is when your bladder drops into your vagina or hangouts of your vagina opening. Sometimes surgery is required to fix this problem. Next, please. What's the most common urinary system problem? Symptoms vary depending on what condition you have. Many conditions share similar symptoms, like change in how you pee. This could include many different symptoms, like having to pee more or less often, and pain when you pee. Another, change in your pee. This may include pee that's brown, cloudy, or contains blood. Pain in your abdominal region. Some of your urinary organs are in your abdomen. People with urinary issues may have pain or feel pressure in that area in their body. And finally, fever, muscle aches, and general unfeel feeling. This could all be symptoms that indicate infection. You may also experience nausea or vomiting. Next, please.
Common symptoms of urinary tract condition can include changes of urination frequency, pain during urination, and changes in the appearance of urine, such as a big brown cloud or containing blood. Additionally, individuals with urinary tract issues might experience abdominal pain, tiredness, or depression, as the urinary organs are located in this origin. Fever, muscle, and general feeling of being unwell, and symptoms like nausea or vomiting can also indicate an infection related to urinary tract problem.
What's the scan check for urinary system conditions? And during analysis, this test is used to assess the presence of bacteria, blood cells, protein, and other markers of disease in the urine. Sonography, this test used when the two creating images of the urinary system. Interview urography, this test use injection to obtain detailed images. Computed tomography, this test use X-rays to create detailed images of the urinary system. Next.
So, how can I keep my urinary system healthy? Well, first, use the bathroom often and when you need it. Be in a relaxed position while urinating. And 3, about constipation. 4, do pelvic floor muscle exercises. And 5, wear cotton underwear and loose-fitting clothes. 6, exercise regularly. And 7, keep a healthy weight. 8, drink plenty of water. 9, limit alcohol and caffeine. And 10, quit smoking. And the last one is 11, know your medication. Thank you.
Thank you very much.